What's up, guys? This is Dr. O from Innovative Dental, Cosmetic and Implant Center. That feels good to say. That's really the focus of this channel. So we're gonna start talking a lot more about cosmetic and implant dentistry. We're gonna take this guy right here and we're gonna see how we took him to an amazing smile by the end of this video. We're gonna show also in a future video how we had a broken implant and how we fixed it for him. So, this little story is gonna be a two-part series. You'll see the video with the smile transformation and fixing all of that wear. Check that out. And then the second video is gonna be really about how did we address this broken implant. That's pretty rare, right? But why did it happen? How can we avoid this? I'm just saying, if you've tuned into this video and you've clicked it and you need, got tons of wear on your teeth, or you need an implant, you're gonna wanna watch these next few videos before you go to a dentist. It's gonna give you tons of information. It's gonna arm you with the right knowledge to get your smile done correctly. And you might choose to come see us here at Innovative Dental in Springfield, Missouri. But if you don't, hey, you're still gonna get something for it. By the way, if you do during this video feel like, I learned something, please give it a thumbs up and subscribe, if you want to learn more. I mean, sometimes I can't tell you how many people have said I had to watch like 100 videos before I got the courage to give somebody a call and get my smile fixed. So let's dive right in. This guy came to us with this issue of tooth wear, and he also had some misalignment. He's got this canine that on his lower arch is sticking out in front. So we've got an issue with its position. We really needed to use some alignment to get that right back in the right spot. We don't always have to do that, but for him, it was the best choice. And so we decided to go ahead and move that tooth back in with some clear aligners. And then after we did that, we had to use some amazing technology to come together and raise the teeth back up, create the proper dimension and height, and then give him a bite that looks good and functions well. That's kind of the biggest issue that I see with tons of tooth wear is, people want to have a nice smile in the front, right? They go, can you just fix these front 6 teeth? And I think that's a common thread. I think people think there's a few veneers you could do for that. And I understand where that thinking comes from because they don't have to restore teeth. They're not a dentist. And so they don't realize that those teeth, if we were to make them longer, would just bang against the lower teeth and you wouldn't be able to chew on anything because nothing in the back would connect, would be hitting correctly. You really have to raise the bite completely. And that obviously is more involved, more complicated. Now, the great news is it's not as involved and it's not as complicated here at Innovative Dental, and I'll get to that. But that obviously is a little bit more expense, a little bit more to do to keep your teeth. And it's because you have to treat all the teeth. You can't just treat the front 6. You have to now treat the upper 12 to 14 teeth, and the same thing typically on the lower. Sometimes we can get away with just treating one arch. So it really depends on how bad the damage is. If you catch this early enough, a lot of times you can do it with just one arch, maybe the worst arch, and you can raise just the teeth on the upper arch or just the teeth in the lower. Obviously, the preference would be the upper because if we're raising the teeth on the upper, we can veneer the front teeth, make them look even nicer. So you get the benefit of the cosmetic aspect if we did one arch on the upper. For this gentleman though, we decided to go ahead and do the full thing. We did upper and lower teeth. We did veneers on the front ones and some crowns on the back. The reason the crowns, they have to cover the top surface of the teeth so that way they actually increase the height of the teeth. The last thing we want to do is take somebody who has tons of wear, which keep in mind, that means that they've worn through the enamel, they've worn through the dentin, and now they're down getting really close to the nerve. The last thing we want to do is prepare the tooth with another millimeter of reduction and drill right into the nerve or make the tooth extra sensitive, make more root canals. That's why it's really important, to avoid these problems with full mouth reconstruction, that we position the teeth in the right position and then actually focus on getting the bite height to be correct. We're able to do that now with a really cool procedure. I've shared that in a couple of the Instagram stories. By the way, if you haven't, follow us on Instagram, ID Springfield. It's kind of fun to share on there and connect with you guys. But I've shared in a few stories on there how we do that. So we use those bite blocks in the back to really create the right dimension after we've kind of built that smile, those incisal edges, the edges of the front teeth to the proper length. We build that up, take some images, and we're able to utilize that to, in software, reconstruct this smile, mill out these veneers and crowns in a matter of a few short hours, and then bond them in same day. So that's what makes it so unique, is that instead of taking many months using a lab that doesn't obviously have the patient and it has to use a fake jaw rather than the real jaw. So there's some advantages there really to this process when it's done all digital. And so pretty excited to be able to offer that to our patients. Incredibly unique. Pretty awesome here at Innovative Dental to do full mouth reconstruction, open the bite, one day, nail it for patients, and makes a big difference. Like I said, sometimes you can do single arches, and then most of the time it does require both arches, especially when it's been pretty severe. Let's go ahead and show you the after photos, right? Who wants to see what it looks like when we're all said and done? So here is his new smile. Here he is smiling with me. What a cool guy. It's really exciting to see when he smiles, all you see is those nice white teeth. Some people are like, well, do I have to have my photos? No, you don't, right? We do tons of smile reconstructions and veneers, and patients, we have a paperwork, right? If you want us to be able to share your experience and your smile with other people to help them, and you're comfortable with it, we do it. If you don't, then we go, that's cool. Understand not everybody's comfortable with sharing their before and after. So don't let that keep you from coming to Innovative Dental. I think that might go through some people's minds. I've had some people ask that. So I would just clarify, you can come see us without having your photo on all social media and a YouTube video. Another thing you need to know is that the shade of your teeth is your teeth, right? You'd get to decide. I mean, I have some ideas. Obviously, why would you spend a lot of money and not make your teeth whiter? At the same time, it's got to be a smile that feels like you. And that's really what we pride ourselves out with, is this gentleman, we create a smile for him that makes him feel comfortable to go out in the world, smile comfortably, confidently, and it feels like it's his smile, not just a smile out of a box that everybody gets the same shade, the same shape. This is what everybody gets, right? So we really love the fact that I get to connect with you and design a smile specifically for you. And so we go over all that in your virtual consultation. I'm gonna go ahead and drop that little pin right there. Down below, you want to make sure that you go to yoursmiledestination.com, yoursmiledestination.com, the link's down below, and that allows you to connect with us and myself, and we'll do a virtual consultation with you and get you over to Springfield, Missouri for a quick, couple day in and out, brand new smile. Doesn't that sound like fun? So hopefully this video has helped you understand what's possible. That's really what these smile reveals are like. Hey, cool. What do we start with? Right? We started with this, and then where did we end up? And wow, we were able to go from this guy that had this worn teeth, and now he's got a nice big smile with whiter teeth and just looks like a more confident, younger, excited person, right? So that's what we want to show is possible, because I feel part of the reason people don't choose to follow their dream with their smile and do it is they're a little concerned about who can get them the smile they want, and they're also not sure if it's possible to fix. And I think that those things are pretty daunting. Obviously, we have payment options. I think that's the other one, right? I get it. It's a lot to invest, but people invest a lot of money in a lot of things. And we obviously try to help make sure that it fits a budget. We have payment plans and options for you. So that's all gone over in our treatment planning after our virtual consultation. So we're very clear about that. You got to be clear about treatment, got to be clear about payment. We want great relationships with our patients. And so we work hard to make sure that you get that here. All right, that's enough rambling for this video, but I hope it was enjoyable. I hope you learned something about full mouth reconstruction with crowns and veneers and raising the bite back up to give it something that looks really nice and pleasing and changes a life. That's the best part of it, right? So like, subscribe, all that good stuff that we try to tell you in every YouTube video, so that way more people can learn about dentistry and be excited about what all this technology and philosophy about changing lives with a smile can do. And before I close this one up, I want to just say, watch the next video. I'm going to show you how an implant was placed incorrectly on this guy, and it caused a lot of problems. It broke the implant and caused an infection. And so definitely watch the next video if you're thinking about getting a dental implant. Let's go ahead and keep smiling. It looks good on you.